Assalamu alaikum. Bismillahirrahmanirrahim. We have started with the medical legal autopsy. This is performed according to the laws of the state. And aim is to find out cause of death, mode of death, and time since death. The dead body speaks, provided one can understand. The dead body can answer the following questions. Who are you? What is your age, sex, height, state of health, profession, social status, and you belong to which area? What happened to you? When it happened? How it happened? Did you try to defend yourself? Which kind of weapon was used? How long you survived after the attack? Was you born alive? Any associated crime with death, for example, rape or sodomy. It is examination performed on the laws of the state, ordered by the. In our setup, most of the time it is on the requirement of police. It is police inquest in more than 90% cases, and in 10% or less than this, it is magistrate inquest. Providing factual, objective medical report for the law enforcement agencies, and aim is to help the law in furthering justice. Vitropsy, this is done in developed countries. In this, no incision is given to the dead body, and problem with this vitropsy is that samples can't be taken. Modern advanced techniques. Autopsy table. This is mortuary where dead bodies are kept. Autopsy table. Instrument used to give incision to the dead. Prerequisite for medical autopsy are a written request by the SHO concerned, injury report as written by the police, and first information F, that is FIR as written by the police. This is report written by the police, and according to this, the dead body is recovered from which place, and it also mentioned the Thana concerned, Tahsil district, and what was the cause of death according to the police. In this case, it is firearm injury. After doing autopsy, doctor has to issue the post-mortem report, which is medical legal report. Along mentioning the autopsy number, the date on which it was performed. Usually it is started after recognizing, after identification of the dead, and the person's relatives or family friends who can recognize the dead, they are to be arranged by the police, and their name and their computerized national ID card number must be mentioned. All body cavities are supposed to be open, even if cause of death is obvious in one of the cavities. Three cavities of the body, that is cranial cavity, thoracic cavity, and abdominal cavity, all must be open, and they must be properly inspected and mentioned in the autopsy report. Cause and the postmortem interval must be mentioned. A sketch are given, and they must be, this diagram must be properly labeled, and for the easy understanding of the court. Aim of this report is to write a comprehensive report which is useful for the law enforcing agencies as well as for the court. Various stages of autopsy. Incisions we have already discussed. How thoracic cavity is open, how cranial cavity is open, and how abdominal cavities is supposed to be open is mentioned. opening of cranial cavity. Collection of samples for laboratory examination, for example, blood, CSF, or various organs. For histological examinations, tissue samples are preserved and sent to forensic science laboratory. Specimens for suspected case of poisoning. Two causes of unnatural death. Number one, trauma. Number two, poisonings. Choice of specimens taken and their quantity is mentioned. Preservatives, usually in more than 90% cases it is saturated solution of sodium chloride. Other preservatives are rectified spirit. For histology we use formalin with 10% formalin. After autopsy the dead must be properly reconstructed in the best cosmetic. Reconstruct the body to make it presentable for the relatives. The dead body is handed over back to police for further handing over to the relatives or family friends. In about 10% cases, in spite of all efforts, no cause of death is detected. Such type of autopsy is called negative autopsy. What are causes of negative autopsy? We have discussed it already. Autopsy findings in death due to starvation. History and investigations are done by the police. Doctor is supposed to examine the dead body after giving incision according to the law of the states. Body will be emaciated. Muscle mass will be lost. The omentum and mesenteric fat will be absent. Digestive tract is atrophic. Small intestine may be so thin as to be almost transparent. There is general reduction in size and weight of all organs except brain. Organs are atrophied. This appearance of intestine, that is paper thin, is considered as typical of death from starvation. Gallbladder is full and distended because there is no call for bile from the intestine. Bones are demineralized. Post-mortem or autopsy finding in case of death due to drowning. Typical drowning, that is wet drowning. Dress will be wet. Cutis and sena will be present. Foam will be coming from nose and mouth. Cadaveric spasm may or may not be present. A professor of forensic medicine working in this field, he has diagnosed only 2 cases. He was able to find only 2 cases of cadaveric spasm over a period of 30 years of his experience. So cadaveric spasm is not so frequently present. Injury to fingernails, hands. Drowning media will be present in the stomach. Oedematous lungs, also known as emphysema aquosum. Pitting on pressure, oozing of frothy blood on cutting the lungs. Rib markings will be present on the lungs. All these findings are about anti-mortem drowning, when drowning is the cause of death. Sometimes dead body is thrown into water. Aim is to hide the crime or create some confusion. That is post-mortem drowning. Cadaveric spasm. Froth coming out. You press the chest and more froth will start appearing. If we touch it with the stick, maybe a toothpick, and we can take it up to about 10, 12 or 15 inches above, it will be just a thread will appear because of gelatin. This froth is gelatinous. Froth. Cutus and Serena is visible in this slide. Another, scuba diving, swimming underwater. Scuba is actually abbreviation of self-contained underwater breathing apparatus. Sea divers. Hazards of scuba diving. Injury due to changes in the air pressure, barotrauma, decompression sickness, effects of breathing high pressure gas, nitrogen narcosis, oxygen toxicity, barotrauma due to pressure differences. It occurs during ascent and descent. There is injury to eardrum or to lungs. Decompression sickness, also known as Cassini disease, because the gases are dissolved more under pressure, and this gas is coming out bubbles affecting the nervous system. Nitrogen narcosis, alteration in the level of consciousness. Oxygen toxicity, diver may inhale more oxygen. How to write post-mortem examination report: name, apparent age, date, and when autopsy was performed. All the body is examined in detail. External examination with dress and without dress. Then all three body cavities are opened and properly examined. Stomach contents, pericardium, injury to heart. Coronary arteries must be properly inspected, because in 60% of cases of sudden death, which may be natural, is due to coronary artery disease. Organ of generation must be properly examined. External examination, we note the build or nourishment of that person, its length, its weight. We can find out what was the expected height of that person simply from measuring the distance from from suprasternal notch up to pubic symphysis and multiply it by 3, or from top of the vertex till pubic symphysis and multiply it by 2, or if a single arm, maybe right arm or left arm, is found, we can also guess about height of the person by multiplying it that length of that arm, right or left, with 2, plus adding 30 centimeters, 15 centimeters for each clavicle, plus 4 centimeters for sternum. So we can have some idea. Similarly, if forearm is found or brought to a doctor, we can also guess height of that person by measuring olecranon tip of middle finger and then multiply it with 5/19. We can also, if humerus is brought to the doctor, we can guess about the expected height of that person to which this humerus belongs by multiplying it by 5. We can guess height of person from skull, from vertex length of skull multiplied by 7, or from top of vertex till chin multiplied by 7. We can have some idea about height of that person during life. Judicial hanging. What are causes of judicial execution? In our setup, mostly it is by hanging till death. Assalamu alaikum.